Good morning. Thank you for joining us. Running a few minutes late, so we appreciate your patience. This is the Alzheimer's Disease and Related Conditions Advisory Committee meeting. Today is November 6, 2025, and we expect this meeting to run to about 2 p.m. Next slide. I am Carol DeAndres. I am the MPA Stakeholder Engagement Manager here at the California Department of Aging, or CDA. Next slide. Just letting you know, this is the meeting logistics. You can join by phone on our Zoom platform, and the meeting slides and recording will be posted to the CalHHS, California Health and Human Services Alzheimer's Disease and Related Conditions Advisory Committee webpage. Next slide. We have American Sign Language. Thank you so much, Jessica, and to your partner. We appreciate your being here. Closed captioning is available. You at the bottom of your Zoom toolbar, you should have a CC icon. And if you click that, you will be able to show the transcript. And if you can't see that, sometimes it is hiding under those three dots, the more button. So give that a look. Next slide.
This needs to be connected.
If we can mute maybe the meeting room, I'm going to go ahead and do that. This is a hybrid meeting. There are in-person attendees at the California Department of Aging. And for our in-person folks, we do have evacuation procedures. Please follow your CDA representatives in there to the stairwell. And also, if you have trouble navigating stairs, the CDA staff person will assist you, get you the help that you need to evacuate this building safely. So thank you for paying attention to that. I'm sure everything's going to be great. Next slide. The chat function is for the committee members and CDA staff and other guests to share out meeting-related information, and you're able to view that in the chat. If you have public comments, we have 2 public comment periods, and additional public comments can be sent to the Engage email box at engage, ENGAGE, @aging.ca.gov. Also, the question and answer feature is enabled, so if you need to put a question in there, we will endeavor to respond at our earliest opportunity. Okay, we will have public comment, and we will go over the procedures
Carlos,
at that time.
if we don't have a resolve in the next few seconds, you should turn on your audio.
Next slide. So at this point, we're going to go ahead and turn to Carlos. Do you have your camera on, Carlos? There you go. Thank you. Carlos, go ahead and know that the secretary has joined us, and so she is ready to present when after your opening presentation.
Okay, can you hear me?
Yes.
All right, thank you.
Thanks, Carlos.
All right, good morning to everyone. I'd like to officially call this meeting to order. Right?
Yes.
Okay. Welcome to the Alzheimer's Disease and Related Conditions Advisory Committee meeting. We're glad to have you with us today. Before we begin, I want to remind everyone that this meeting is being conducted in accordance with the Bailey Key Open Meeting Act, which requires that our discussion and decision making remain transparent and open to the public. If you are a committee member, please turn on your cameras so that we have a clear visual record of attendance and participation. We will now take roll call to confirm who is present. If we could please have the names of the members on screen, please. Thank you. All right. Dr. Wynn Canino
She'll be joining later.
should be joining us later. Carlos Rivas, yeah, I'm here, thank you. Assemblyman Dale, I'm probably gonna butcher this name. Pellerin.
Helleran,
Do they say I?
here.
Here.
Can you hear them, Anna? Can you hear them? It's okay. Next.
Okay, Senator, Ellery Wayne,
Morning, Carmen Aon, on behalf of Senator Arreguín.
you. Sally Bergman,
Present.
Claire Day,
Present.
Dr. Dolores Gallagher Thompson,
Yeah, I'm here. Hi, everyone.
Myra Garcia. Ken Bracknell. Barbara Linden,
I'm here.
Dr. William Wolby,
Here.
and Dr. Quasi,
Here.
Sabine Regalia,
Here.
Julie Sol.
Julian, I'm here. Thank you, Carlos.
Dr. Reyes.
I'm sitting in for Dr. Farias today. Not a voting member, but I'm sitting in on her behalf.
Thank you. Next.
Approval of the August minutes.
So we need to move to approval of the August meeting minutes. Do we have a motion to approve the minutes as presented? Second. Thank you, Claire. Do we have a second?
Sally Bergman.
Sally.
Second.
All those in favor, please say aye.
Hi.
Hi.
Aye.
Any opposed?
Hearing none.
Motion carries. The August meeting minutes are approved. Before we begin today's presentations, I am honored to welcome Secretary Kim Johnson, Secretary of California Health and Human Services Agency. We're grateful to have her join us today, provide opening remarks, and help set the tone as we honor Alzheimer's Awareness Month and National Family Caregivers Month. Please join me in welcoming Secretary Kim Johnson.
Thank you so much, Vice Chair, and thank you for your leadership. A pleasure to be with you. And I also want to thank all of the committee members for their commitment to supporting individuals with Alzheimer's and dementia, family members, and caregivers. And as you just heard, this month, November, is Alzheimer's Awareness and Family Caregiver Month. And it's dedicated in highlighting the importance of early detection and diagnoses of Alzheimer's disease, as well as supporting caregivers and families affected by the condition. So we lift you up and more to do in recognition of supporting those with Alzheimer's and in how we're connecting with them across the spectrum of services. It's also National Family Caregiver Month, and I want to lift up and honor all of the family caregivers. According to a recent report, more than 7 million adults in California provide care to a family member or a friend with complex medical conditions or disabilities. And the majority, 92% of family caregivers provide support to adults with complex medical needs. We are also in California, the home to the largest Medicaid home and community-based waiver in the nation. In-home supportive services, supporting more than 700,000 individuals and paying, again, family members for their vital care and support. So a lot to recognize and celebrate and recognize the efforts we've made together in support of everyone playing this role. So we see you and acknowledge you today and in the month of November and always. I also just want to acknowledge, and unfortunately, I'm only with you for a brief amount of time, and that's because obviously you would anticipate a lot of my time, as with many individuals, is focused right now on addressing some of the ways in which federal actions are causing harm to our overall progress of a healthy California for all. Certainly, the federal climate brings a tremendous amount of uncertainty. It is also reducing access to critical health and safety net services. And we want to ensure that California continues to lead with our North Stars in mind and mitigates the harm to what we are experiencing. And of course, kind of front and center for us right now in the federal shutdown are the 5.5 million Californians who are in need of their critical food supports, many of which are older adults. So we are all in on, and again, mitigating harm to individuals and ensuring that communities have the best resources that they need. During these difficult times, I want to say, though, we are differently situated in California, one, because of the work that you all supported and many others in developing a master plan for aging, which is our guiding light. This advisory committee is one of 7 of the master plan for aging advisory committees that we count on, that we turn to for grounding in the real life lived experience of diverse Californians. You are closer to the ground. We always have an open door to input and feedback during these meetings and in between meetings as things arise. So we count on you as our partners in these efforts. California can take pride in our long-standing commitment to this advisory board, the Alzheimer's Disease and Related Conditions Advisory Committee, or ADRCAC, was established within the California Health and Human Services Agency in 1988 to provide ongoing advice and assistance on program needs, priorities of persons impacted by Alzheimer's disease, and related dementias. The committee members come from diverse backgrounds and represent consumers, family members, providers, and advocates. Governor Newsom continues to demonstrate California's commitment to prioritizing Californians directly impacted by Alzheimer's disease and related dementias through significant new investments, such as the Master Plan for Aging, as well as the Governor's Task Force on Alzheimer's Disease Prevention and Preparedness, and its bold recommendations. The state's invested in a network of public health-led disease centers, public health-led Alzheimer's disease and related dementias research with a focus on women and communities of color, 13 public health California Healthy Brain Initiative state and local public health partnerships to address dementia, the Department of Aging-led federal grants focused on connecting people with dementia and their caregivers to resources, building off of the community health worker models. And these targeted initiatives demonstrate the state's shared commitment to improving health outcomes and reducing disparities in California through meaningful response to Alzheimer's disease and related dementias in the coming years. So this committee, in existence for almost 40 years, has endured through difficult periods over those 4 decades of time. We will get through this one too, and we'll get through it together. You are one of the best representations of California values and commitment, and it's fundamental to our work across California Health and Human Services and the departments that we support. We will turn to you, and we hope you will turn to us as we navigate these times together. I want to thank you again for the commitment and everything you're doing and being our touch point. And we very much look forward to engaging with you on making the lives of Californians better. Thank you for the opportunity to be with you this morning.
Thank you for your continued engagement and dedication. With that, I'll transition us to our presentation in honor of Alzheimer's awareness and it's a pleasure to introduce our first presenters.
Excuse me, Carlos, the audio is not great. It is cutting in and out. I'm wondering if um, your speakers would be better or no? Did we already try that?
I mean, this
Give
is
us a
not.
second. We're adjusting real quick here in the
Oh.
room.
Oh, you sound much better right now.
Okay.
Whatever you're doing, don't move. Go ahead.
Don't move. Everybody relax. We have it under control.
It's great. You sound great. Go ahead. Sorry to interrupt.
All right. So let's begin. We're honored to welcome Dr. Jason Garvano, Associate Clinical Professor at UCSF Fresno, and Dr. Lauren Alving, Geriatric Specialist at UC Irvine. Today, they'll present Dementia Care Essentials, a guide for family caregivers, a practical resource for families supporting loved ones with dementia. Welcome, Dr. Gavano and Dr. Lauren Alving.
Great. Thank you. Unfortunately, Dr. Alving won't be here today, and we are, I think, welcoming Dr. Steve Tam from UCI. Thank you all for letting me present today. We're happy to present this collaborative project from CDPH and UCSF and Valley Caregiver Resource Center. Next slide. We were tasked with trying to develop some semblance of a caregiver training program for people that are helping with dementia care. As you know, many of the caregivers for people with dementia are family and unpaid caregivers. They have various backgrounds, different educational, cultural, and linguistic backgrounds in California. And they may or may not have much direct resources for trainings in dementia care, depending on where they live and other barriers. So we sought to early on use a curriculum development model to try to establish what would be an adequate pilot program for a caregiver training program using this model we all refer to it as current 6 steps. As you can see here, there's many different steps and they go back and forth on each other so that when you learn from one step, you can go back and improve on prior steps as you develop the program itself. So this is, again, curriculum development model. And CDPH tasked us, UCSF Fresno and Valley Caregiver Resource Center with prioritizing the caregivers of Northern California. Next slide. So what the first step in this model generally is identifying the problem. Well, we know that there's many unpaid caregivers of persons with dementia. There's various trainings on dementia that are intermittent and hard to access at times. But there is good research that caregiver training has positive outcomes. So we know that this is a good idea, and we would like to see if we could implement it on a broad scale. So what did we do with each of these problems? Well, we decided early on we would hope to do a free and accessible program that does not presume a lot of prior knowledge in dementia care, so anyone can access it at different levels of education as best we can. We also wanted to have it be available in multiple languages so that it can be accessible for our, for many in Northern California, and also relevant to many different cultures. The last item here, we wanted to see if we could provide this training at scale and leverage the existing resources, not reinvent the wheel, to synthesize a curriculum that points caregivers to the existing resources in a structured way. Next slide. So what does the research on caregiving show? Well, there are many different ways to look at the benefits of caregiver training. There's well-being factors, support for their caregiver, well-being, support for the person with dementia. There's also other outcomes like service utilization costs, satisfaction with the programs, etc. Our team really wanted to focus on the programs that had backing in caregiver well-being and person with dementia well-being, as well as support for them. This information was culled and reviewed from the best practice for caregiving site, which is provided by the main caregiver organizations here in California. So we can go to the next slide. So what we first wanted to ask the people that were involved in caregiving, what were they needing, what were they lacking, what barriers did they face, so that we could understand how to avoid those as this pilot program was being developed. So we did a web-based survey of people in Northern California that were already connected to a caregiver resource center, particularly Valley Caregiver, and then a couple up in Northern California. Next slide. What did we find? The first thing we looked at was barriers, and it was very frequent for these caregivers to report time commitment and scheduling conflicts as big barriers to enrolling in a caregiver training program. We wanted to keep that at the forefront of our development, that we didn't want big time commitments or scheduling problems to be the main reason people were not going to be using this. Next slide, please. The topics that these individuals were most interested in learning more about was planning ahead for more care and deciding on the right living arrangements for the people they were caring for, as well as some other ideas like treatments and medical interventions for the different dementia types. Next slide. They also wanted to understand how to actually get access to care, like respite programs, finding local resources, and keeping the person they're caring for happy and contented. On a personal level, they wanted to learn how to deal with the stress and burnout that comes with caregiving roles, dealing with the changing roles that come as you turn from partner or adult child or friend to caregiver, and then ways to take care of oneself during this task, as well as, of course, understanding dealing with changing behavior that dementia can sometimes bring, as well as the emotions and arguments that can sometimes come from misunderstandings. Next slide. The format that was preferred by the people we surveyed was primarily online classes and online videos on the computer, and they wanted it presented by professionals as well as other caregivers. They wanted the trainings relatively short. That goes with the need for it to not be overlong or too lengthy. And less, 0 to 30-minute training periods so they can fit it into their busy schedules. Next slide. So the goals and specific objectives after learning more from our caregivers that we surveyed was develop a program that covers this foundational dementia care knowledge and gets around these common barriers and then directs people to establish resources. We also needed to develop a mechanism for getting feedback on how the program's working so we could understand for future needs if this program is working well, or if it needs to be improved. So program evaluation and improvement. Next slide. So we ended up developing a website that has interactive trainings. These are web-based modules with video content that are relatively short, meaning less than 30 minutes. The majority of them are less than 30-minute blocks. They have knowledge checks where people can, answer quick questions about what was presented in the topic and give feedback on the answers there. And then we had our educational materials represent many different learners. This is one of our goals for making sure that our materials made sense for Northern California. Next slide. So the implementation of this website, there's various learning modules that have different emphases. The first is an overview and welcome to kind of get people to understand what this is and what it isn't. This isn't a way to get around going to your caregiver resource center or anything like that, but it's hopefully a self-paced didactic series. People can feel confident in self-navigating. And then, of course, what is dementia, which comes up very frequently, the terminologies used, and getting the groundwork laid for early caregivers to understand the disease and conditions. Then there's two separate type of topics, coping topics, which address the caregiver's desire to do self-care activities and understand the stress that comes with caregiving and ways to cope and manage. And then adapting to the changing needs of the person they're caring for, including communication differences and the changes in thinking and behavior that can come. Those ellipses are to note that there are other sections. I just didn't want to make the slide too busy with specific changes in behavior and specific changes in thinking. And then the last section there is grief and loss to try to orient caregivers to understand how those changing roles impact caregivers and how to try to navigate that with help and support. Next slide. The initial feedback of our curriculum from expert reviewers, so people that were not involved in the production of each individual module, they were willing to give us some feedback, but they were generally positive, and I'll go through a little bit of those here. We made updates to the content before they were made into the videos for vocabulary, terminology, and clarity based on this expert review. We're also getting feedback from voluntary surveys. So, if a person's on the website and they choose to do a survey, which is their choice, and we're not obligating anyone to, they can provide us with that survey data, and we can look at that later to see where this is succeeding and where it may not be meeting needs. And for people that are involved in programs at the Alzheimer centers, as well as the caregiver centers, we're offering some gift card incentives for people that are willing to give us this feedback directly. Next slide. So this is the expert reviews. It's a scale from 1 to 5, 1 being excellent and then 5 being poor. And you can see that the expert reviews were very, very positive in their length and clarity and pacing, the educational accessibility of the materials, the breadth, accuracy, demonstrations of knowledge and skill in dementia care, and the relevance of examples. Again, this is prior to making tweaks and suggested updates from them. Next slide. The other is community-related reviews. So community resources and cultural accessibility, mean did these talks have enough of that linkage to these ideas and methods to be useful? There's also, we also wanted to know if this is appropriate for multiple stages of dementia. We said early and later to be a little bit vague intentionally, because dementia can look quite a bit different. But these experts thought, yeah, this was probably good for both different caregiving roles in this continuum. Next slide, please. We're getting that feedback survey and workbooks. So for each of the modules, we have an option for a person to fill out an evaluation of that module, as well as answer some questions about the content. We don't provide feedback on that particular one because we just wanted to see, are they getting what we thought they should be getting in this module? And we can evaluate that. It's a program evaluation, not an evaluation of them. It's based on some standardized research, like the Dementia Knowledge Assessment Scale. And then we also I have a validity check in there to make sure that we're just not getting random responses, because we have that problem with online survey data at times, as well as some demographics to learn more about who. Can you go back one, please? There's also workbooks that are our attempt to try to provide updates to individuals for linking directly to things that they want to know about. For example, if they're really interested in learning more about behavior, on the behavior modules, they can do a survey or workbook for behavior, and they can click the things that they want to learn more about. And it directs them to resources from existing associations, advocacy groups, dementia care groups, and so on for those topics. So it's a starting place for them to have information to then bring back to the care team, but kind of direct them through existing navigation things from partners in this work. Next slide. I want to thank everyone that made this happen, especially CDPH and the leadership there. We would not have been able to do this without the regular guidance from Cindy and support. Dr. Alving, who's the PI for this project, and then our contributors for the content development, like Alexis Glidewell, Andres, and Roberto Avalos. The Valley Caregiver Resource Center, and specifically the leaders there, like the new executive director, Megan Velasquez, and then our many contributors and expert reviewers. Thanks all.
I think that's it, right? Okay. Thank you for your insightful overview. Let's open the floor for committee questions and comments. You have a question, Claire?
Yeah, thank you, Jason, for that presentation. And I apologize if I missed this. Is this only available in English, or are there multiple languages that this program is available in?
Yeah, this is available fully in English and Spanish, meaning everything has gone through translation and clinician review. And then it's also available in bilingual settings for Hmong, Punjabi, and Vietnamese and simplified Chinese. The goal with having bilingual was that we didn't have enough in the front end on this pilot project to make it fully, one language. And we thought that in the interim, what we wanted to do was provide content where people in a group setting with perhaps some bilingual individuals could have, group format discussions about this topic and go back and forth. And ideally, we'll be getting feedback on if this is sufficient or if we need to go further along the cultural adaptation realm for those other languages as well. So it is available in multiple languages. I would say that English and Spanish are the most well vetted by our clinicians, the ones that had weighed in on the development. And then we have translations that have been made there. They're available in the scripting, the transcripts, and so on. So you can do closed captioning and so on. But that is a bilingual effort, meaning it isn't just in that language. And so you'll be getting the audio in English and then the written information, which has some barriers, unfortunately, for educational barriers and accessibility in that way. But that's where we're starting.
Yeah, thank you. Even sometimes small words can make a big difference if they're translated wrong. So thank you.
Anybody else have a question?
Yeah, if I may jump in, Dr. Gravano, I'm a neurologist. I've been doing a lot of guide enrollments, or some of them slightly different than, of course, some little bit of a different question here. But do you know, to your knowledge, this knowledge based or this curriculum training, do you know if guide programs would be interested in kind of this kind of training early on for caretakers? Or I don't fully understand what guide has yet to offer. I know that we're still collecting data and services, but it is sort of becoming entrepreneurial. A lot of companies are getting involved. But I see that element of caregiver training is still lacking to a great extent. Just wondering your thoughts on that, if you have any experience with that program or whatnot.
Yeah, I'm optimistic that there'll be some integration with existing symptoms and other pilot programs. I don't really know, again, to what extent, what ways this will be, picked up. We need to make sure that this has enough beyond its pilot data to support it as a broader program. But in terms of that, getting it out there and as pilot data for people and saying this exists now, and you have a method for telling us what works and what doesn't work with it. I think that it could be very useful to some select groups that are very, again, excited. And maybe Cindy can talk more about that from CDPH about her experience, because I'm not involved enough to know the mechanisms and what would be a reasonable fit. We have tried to think and develop ways to formalize this.
Yeah.
Not just, have it regular and voluntary, but have it formalized where it's offered as part of a structured incentive program or something along that, with which Guide could provide. But I don't know. I'm not a logistics person. Thank you.
Understand. Thank you.
Barbara.
All right, Barbara.
That conversation is sort of along the lines of what I was wondering about is, how are you getting this out there so that people are aware of it and will use it? Because that's always the challenge. There's actually many wonderful tools and trainings that have been developed over the years. And as your own caregivers, when you surveyed, showed people are very busy and they luck into them at 1 o'clock in the morning when they're online trying to figure out how to, survive. And so, I just feel like this is always the challenge of, okay, if you've got something great, how do we get it in front of people?
Yeah, our project was mostly developed on the curriculum side and developing, the kind of standards there. The dissemination is, I think, something we need to look a lot more into before I can answer that in a clear way. We have an outreach plan that involves the CADCs, because we worked within them, the California Alzheimer's Disease Centers, as well as the caregiver agencies that will be on next, the next speakers, to try to see in what ways those can be regularly disseminated. We're offering some brief webinars for the people that do intakes upcoming for training people so they know that it exists and so on. And then I know CDPH wants to do some advertising itself. Our caregiver agency here in Fresno advertises this directly to our community. So there's some in that. And we had plans to do a broader one, but with the other caregiver agencies, but that was just unfulfilled, unfortunately, due to our time constraints. So really good question. We were not in the dissemination planning phase. We have some ideas, but it will take a little bit more work and effort and elbow grease and commitment. And we're outside of our pilot project right now, unfortunately.
Thank you.
Thank you, Barbara, for asking that question. As a family caregiver myself, things like this can be helpful in navigating our journey. So thank you. I think we have another question, Dr. Mobley.
Yeah, hi. Thanks, Jason, for your presentation. Two areas of interest, two questions. In terms of the coping skills, to what extent are emotional dysregulation something that really is difficult for caregivers to manage?
Emotional dysregulation, in what sense?
Well, I mean, you've
Like
got perhaps agitation, other manifestations of dementia that may well be very challenging to understand for caregivers.
Yeah. So I think the question is, to what extent is observing someone you care about distressed for something you cannot directly control, upsetting and stressful for the caregiver? And my sense is extremely high, extremely upsetting and really challenging in many ways. And so in effort to try to do something that is, of course, not something interactive, because that ideally you need some people to actually help with the stress that comes with that directly. But for our learning modules, what we try to do is make our examples particularly relevant to situations that would be potentially distressing to individuals, but not overly so that they get out of their learning environment. We try to also make our grief, our communication and adaptation talks clinician led, so that it's not just slideshows, it's a person talking. So a little bit more connection there. But none of this is meant to replace the needed support of knowledgeable clinicians and support groups around the state. And our group is to try not to replace that in any way, but to direct people to those resources where they exist. So very good question. Trying to meet people where they are with their distress is really challenging. This is not meant to be a 3 a.m. I'm stressed out kind of thing. This is, okay, we've gotten through the rough patch. Now I'm ready to educate myself on things that might help the coping, might help the things go a little more smoothly to get the kind of the routines down that will help. So this is not like a support line. Those exist, as you know. This is not a support group. But we do, talk about that. But really what you're talking about is, how do people cope with the inherent caregiving stress that comes from seeing someone that you really care about distressed for a reason you cannot quite control or manage or deal with. And that is exceptionally challenging as far as I hear from all of the caregivers that we interact with.
And then one more question.
Sure.
Are there objective data for the impact on the actual caregiving itself? Are you collecting that data?
It's not, I wouldn't say objective in the sense that these are voluntary surveys. We're not making everyone do it because we know that the burdens of caregiving are enough. We don't want to force people to go through our caregiving questionnaires. But for the people that do, we have questions that relate to, I think this training will help me cope better. Right? I think this training will be positive and helps me understand. So the questions that we ask after that, when they're reviewing the modules, try to get at this. Again, this is pilot and this is quality improvement. This is not research, right? There's other people that are doing great research on those topics. This is, how do we get something to people to try to use what we know has been helpful for caregivers in the past based on research, try to get them easy to access, self-paced, structured guide to start the process, and then really connect them to the resources that will really help, right?
Yeah, thank you.
Yeah.
Thank you, Dr. Mobley, about that question. And to Jason, I really appreciate this connection of how we're going to funnel people to this training and into support services, like at 3 o'clock in the morning, like I have had to call support lines. It's hard, it's difficult. So this information is very valuable to people like myself. So next, we'll hear from Michelle Nevins, Executive Director of Del Oro Caregiver Resource Center. Michelle will discuss how caregiver resource centers are advancing family support statewide, highlighting federal grant efforts and key partnerships and program goals. Welcome, Michelle.
Thank you very much, Carlos. I really appreciate the opportunity to be here. So let's dive into the slides this morning. If we could go to the next slide. So Del Oro is actually part of our statewide system of California Caregiver Resource Centers, and we're one of 11 in the state of California. We're obviously very proud of our statewide system. That kind of the groundwork for our system began in the late 1970s and was actually a grassroots effort that caregivers who came together that recognized that there was a need for caregiver support in our state, and the dynamic of our state has been ever since just impacted as a result of their great work. And so even though I will be mentioning our statewide system, I will be focusing on highlighting Del Oro because each one, we all offer the same services. However, each caregiver resource center may deliver them a little bit differently depending on the geographic area that we serve. And so one thing I would like to point out on this slide right here is that caregivercalifornia.org is our statewide website. It's a phenomenal website. If you are ever in need of pinpointing which caregiver resource center services your area, you can just drop in the zip code or county and it'll immediately pop up. I highly recommend bookmarking it so that you have that available for clients that you work with. Some of the items on this website, we have blogs and videos, newsletters, podcasts, very practical tools for caregivers just to even answer whether or not they're a caregiver, which, as we know, sometimes just identifying yourself can be a basic issue really early on in the process of caregiving. So if we could go to the next slide. Del Oro was actually founded in 1987. We were the 5th site to roll out of the 11 centers. We actually service 13 Northern California counties. We actually have a very unique geographic area of both urban and rural areas. And we are, of course, proudly funded by the California Department of Aging, along with one of our local area agencies on aging, private grants, and contributions as well to make all of our services free to family caregivers. If we could go to the next slide. Our mission is honestly very simple. It's to improve the well-being of family caregivers and provide support throughout the caregiving process. But obviously that looks different for every client that we encounter. As some of the things that have been mentioned already in our short time together, the mental health, physical health, secondary strains that caregivers encounter, family challenges, care decisions, the number of things families encounter is endless. And, I think that oftentimes when something happens to the primary caregiver, kind of the whole situation falls apart, and we try to prevent that from happening so that there's stability. We plan for plan B so that those situations don't fall apart. If we could go to the next slide. Our eligibility for our services is honestly very easy. Caregiver must reside in one of our 13 counties, but again, if they don't, then there's another caregiver resource center to serve them. The care receiver must be an adult with a neurocognitive disorder. Of course, that includes a whole host of different diagnoses, everything from the forms of dementia, could be ALS, MS, traumatic brain injury, as long as it was acquired after the age of 18. Things that maybe don't yet have a formal diagnosis attached to them, but there's a cognitive issue going on. And of course, the care receiver is not receiving Medi-Cal because there are a variety of programs out there to support caregivers through that process. If we could move to the next slide. We, of course, provide a comprehensive menu of services, information referrals, support groups, education training. We've already heard how important that is to family caregivers, family consultation, respite care, legal services, and short-term counseling. If we could go to the next slide, I wanted to dive into a few very key services that we offer. The meat and potatoes of what we do really is the ongoing family consultation. Of course, that involves a very thorough intake and assessment, plan of care, and periodic reassessments. It's important, of course, as noted already this morning, caregivers are highly stressed. Many are dealing with depression, anxiety, emotional demands, multiple responsibilities, and complex medical tasks. And so the family consultant that works directly with the client develops that rapport, that ongoing relationship over time. It's someone on their team that is cheering them on, providing them that emotional support in a way that many others in their family or social network are not doing. So we're very honored to be able to walk beside families through this process. If we could move to the next slide, I just wanted to provide you with an example of what comes out of the assessment. It's a caregiver action plan. We actually provide a copy of this to each client, and this is just an example of one. We work obviously very closely with a lot of partnering organizations, Alzheimer's Association, MS Society, Parkinson's Association, and you'll often see that in a client's caregiver action plan because we want them to tap into all of the services available to them and outline them so that the caregiver can maximize all of the services that are available for them. We look at this tool together at the periodic reassessment and revamp it as needed so that the client, oftentimes they have their most pressing issue, and we, as we're following along with the client, have determined things that they've told us that will get put into this caregiver action plan. And so tapping into all of those services is key. If we could go to the next slide. Of course, respite care is the key component of providing good family support, and it strengthens the caregiver's ability to have relief, refresh, renew, and we subcontract that out into the community. Some of our sister agencies provide direct care, and the caregiver actually arranges their own caregiver relief. We actually use contracted providers with adult day programs, in-home care, or a short-term stay for the care receiver at an assisted living facility, or a combination of those three. It depends on what works best for the family caregiver. We provide a dollar amount, and the caregiver can use that money however they wish. 20 hours a month, could be 4 hours a week, it could be 2 weeks in an assisted living. It just depends upon what makes the most sense. Usually the respite care is why folks end up picking up the phone to reach out to us, but it ends up honestly being a combination between the family consultation, the respite care, and the education. It's like the trifecta of support that really comes together to make this each and every caregiver feel supported, if you will. If we could move to the next slide. Just very quickly, we also provide, many people don't know, we provide legal support to review documents, get estate plans in place, answer questions about Medicaid, and that's available to our families. Next slide. We also provide short-term counseling. Again, a lot of our clients are dealing with caregiver burnout, stress, depression, and they need a little bit more support than the family consultation. So we provide 6 sessions, very goal-oriented. Some of that's done in-house by our licensed clinical staff. Other appointments are subcontracted out into the community. We find that this can be pivotal for a lot of our clients, that they're feeling much more supported after counseling occurs. So we're happy to be able to offer that to our clients. Next slide. Our education training is done in person or online. We do both. We have, of course, a statewide calendar. The website I mentioned earlier, caregivercalifornia.org/events, has all of our statewide offerings in different languages, a variety of topics, everything from self-care to legal consultations to managing family dynamics. Right now, as we speak, we're inviting dementia to the holiday table is what's happening in our office. So a variety of topics are available. We offer respite care so clients can attend that and be uninterrupted, even if it's online. Next slide. Just very quickly, our annual report for last fiscal year is not yet tied up, so I wanted to give you some of our data from 23-24 fiscal year. Most notably, 88% of our clients are performing medical or nursing tasks, which is something 2 decades ago was not happening. So a lot of pivotal changes have been happening in the home. 79% are providing more than 40 hours a week, more than a full-time job. 36% report their health has declined in the past 6 months. These are the clients that are getting ongoing help and support. You can imagine what the statistics and data look like for clients that aren't getting the support. 69% are experiencing high caregiver strain. So obviously, we want to continue doing the good work so that we can get some of these stats down. If we can move to the next slide, I just very quickly wanted to tell folks that all of our caregiver resource centers in the state of California have contracts with their local area agencies on aging to provide support through the National Family Caregiver Program. We actually leverage our state dollars and to provide that match for the federal funding. And so this actually, when the funds came about in 2001, it allowed us to kind of open the door to more chronic conditions for individuals over the age of 60. In our area, we have a contract with our area agency on aging, Area 4, to provide services and support in Placer, Sacramento, and Yolo counties. And I'm going to have you jump 2 slides, if you will. I wanted to read to you a quote, and this is why we are so thankful to get to do what we get to do. Honestly, Del Oro has been a lifesaver for me. I've dealt with this on my own for several years and was nearing the end of my rope. You can hear the despair in this client's voice. Once I reached out, the support and resources have been a total game changer. Just started respite services that have allowed me to get out by myself for the first time in 4 years. I can't even imagine that. And I'm just so grateful that we were able to service this client. Thank you so much for the services you provide. They have improved my mental and physical health immensely. That is the goal of what we get to do. And then last slide, I just wanted to share that our statewide system has CareNav, which is an online portal forward facing for family caregivers. They can jump on 24/7. If they're having a really bad day and they need resources at 11 o'clock at night, when we may not be available. They can jump on this, answer a few questions about their caregiving situation. It's password protected, HIPAA compliant, and it will immediately provide them with resources and tools on however they answered the questions about their caregiving situation. It will tailor the resources to them automatically. And so that is available to clients. And of course, the old-fashioned telephone website, we answer the phone, of course, still in this day and age, and grateful to get to do what we get to do each and every day for family caregivers. And we're just so thankful that for each and every one of you on this call that support caregivers every day and during National Family Caregiver Support Month. So thank you.
Thank you, Michelle, for your work and insight. As a family caregiver, I appreciate it.
Of course.
Q&A. We're going to go to Q&A. We have a couple people in the queue already. Dr. Quasi, please.
Thank you. Hi, Michelle. Thanks for your presentation. Yeah, so you mentioned that, there's some of the services you outsource to other community partners. How does a local community, aging services organization become partners with a given CRC?
Actually, for me specifically, just call me, email me. I adore working with our community partners. I see many of them on this call today. Claire Day, the Alzheimer Association. Obviously, a lot of our clients are dealing with a form of dementia, and we partner with them on education training. We do a great deal of workshops together, and have done so for decades now. We contract with vendors to provide support. We're working with Tembo. I heard you mention the guide model to provide some of the care navigation for individuals on Medicare enrolled in Guide, and that's quite a few of our CRCs are doing that. So just reach out to the local director.
Maybe you can leave your email in the chat.
Absolutely. I would be thrilled to do that. Yes. Thank you for asking that question.
All right. Thank you for that question. And we'll move on to Barbara.
Hi, Michelle. Great
Hi.
presentation. Super informative. Really appreciate it. My question's about respite.
Mhm.
Is your organization able to provide the amount of respite to meet the need that you're seeing?
That is an excellent question. I will tell you that every fiscal year is a little bit different. As you might imagine, it really depends upon what grants are coming in, how fruitful they've been, or if there's federal dollars, additional federal dollars available. Last year, I will tell you, was a phenomenal year for us. This year is not looking so good, but last year we served 90% of our clients, which is the highest it's ever been. And I would say it's sad to say I've lost Mental Health Services Act funding already for next year in the amount of $230,000, which was 70% of that was for respite dollars. So you can see that every year might be a little bit different. Highs and lows, I will say, but we are in the midst of our annual campaign right now where we do adopt a caregiver funds, and that allows us to expand as much as possible. We usually try to raise about an extra 90 to 100,000 a year. So that does help, but constantly trying to meet the needs of demand. One thing I will tell you that speaks to the demand is our number of clients coming in every month far exceeds what we have openings for. For example, we may get 100 new clients a month and only have intake appointments for about 85 a month. So you can see that we are constantly trying to catch up, and that's just because of the number of staff that we have. We haven't, of course, received, with very few exceptions, our state funding has been fairly stable, and thankfully, so far, but also the same amount for year after year. So great question. Thank you. And it just really depends upon each and every grant and dollar that comes in.
Yeah, thank you. I just, that quote you presented, it was so powerful. And I want to raise an issue for the committee that is happening statewide. So if you're familiar at all with CalAIM and its community supports, well, health plans right now and many of them are eliminating some of the community supports they're providing. And heartbreakingly and shockingly, from our perspective, respite is one of them that is going. So we have a big plan in Los Angeles County that is proposing that they will no longer offer respite as a community support as of January 1. I know there are others. And we know how life-changing respite can be. So we are right now, we have an advocacy push out there to try to hopefully convince this plan to change their mind. But I just think this is something that we should be aware of as a committee, because I think we should be trying to make respite available to everybody who would like it. And that includes, one of the things I think we've had to do some education with this health plan to say, you can't just offer a family respite once. You can't just ask someone once. And then if they say no, say, oh, well, they're not interested in respite. They don't want to use respite. It's a process. It's trust building. It's, they're bringing someone into their home that they may not know. And there are issues around that. But once a family experiences respite, I mean, we see the same thing, Michelle, that you're talking about. They're like, oh my God, I can leave the house. I can go to the doctor for my own needs. And, again, life changing. So, I don't know if this is something maybe we can include in our letter to the secretary at the end, but this is a Department of Healthcare Services opportunity, because they're the ones who approve the health plans when they come back and say, hey, we'd like to eliminate these community supports. And often, it's including respite.
100% agree with you, Barbara. Thank you for bringing that up. And I can't agree with you more. And so thank you.
Yeah, and you said one more thing that I think maybe we'll want to look at, and that is the Mental Health Services Act. You're not the only one that I've heard of across the state that's losing money, and so there is real concern. And we have been down this road before of potentially older adult services not getting adequate funding, especially for prevention and early intervention. So I know CDA has been really involved with in this space, and it's a confusing space too. Like what's the behavioral services what's happening here? A lot of change. But we might benefit as a committee from a presentation on like what is the lay of the land right now for mental health services for older adults, especially
Agree.
those living with a dementia.
100% agree. Yes, I do know the Southern Caregiver Resource Center lost $1 million
Right.
through their program through the Mental Health Services Act. So it is happening, and it's unfortunate. We've had the funding since 2012, and it's gone.
Thank you, Michelle.
Thank you.
Thank you, Barbara, for highlighting those issues, because caregivers like me are, need those resources. So again, thank you, Michelle, for your work. We're going to move it on. We're pleased to welcome now Teresa Weber, Project Director in the Division of Policy Research and Engagement at CDA. Teresa will provide an update on empowering California's Care Workforce Initiative, which focuses on strengthening workforce training, recruitment, and retention across the care continuum. Welcome, Teresa.
Thank you so much. Hi, everyone. I'm Teresa Weaver. I am one of the project directors here, Division of Policy Research and Engagement at CDA. So I just want to say thank you so much for allowing me the time to share some of the exciting efforts that we are doing, what we have done, and as well as what we're going to be doing. So it's very exciting. Next slide. Perfect. So the first project I'm going to share is the Cal Grows program. So this is the California Growing a Resilient and Outstanding Workforce in the Home and Community. Next slide, thanks. So a little background on this project. This project actually came from the Master Plan for Aging, and specifically Goal 4, which is caregiving that works. So the initiative that this came from is number 70, which was to develop and launch curated catalog of free trainings in languages for caregivers and the direct care workforce. So it was for to cover for family caregivers as well as paid caregivers as well. So before we decided on what we were going to do as far as what that project would look like, there was a direct care workforce survey that was conducted, and that was really helped to inform the design of what the CalGrows program would be. So we also really wanted to make sure that we are covering to meet the educational and training needs of California's diverse caregivers. Next slide. Thank you. Okay, so CalGrows. So once we did that survey, we were able to then develop what this project would look like. And this project was very, very impactful. So it was direct care workforce trainings as well as stipends to incentivize, support, and fund career pathways for the home and community-based services, also known as HCBS workforce. And this was specifically for non-IHSS employees. So this project had a few different elements. The first is the training piece. We partnered with organizations across California to offer free caregiving trainings. So there were many, many different topics. There was daily living, body mechanics, care coordination, documentation, nutrition, legal. I mean, it was incredible. But it wasn't just about how to care for those that the caregivers were servicing. It's also for the caregivers. So other topics included managing stress, self-care, and even communication. And there were other topics that were also included that were specific to patient conditions. So that also included dementia, COPD, depression, PTSD, weight management. I mean, these are just some of the topics that were covered, but it was incredible. There were many, many different topics. So the accessibility and training preferences. So part of the survey included how would be the best way to offer these trainings and different modalities for caregivers to increase access and ability for caregivers to take these trainings and for them to be able to take in the training content. So the trainings were offered in a wide variety. Some were offered online, some were offered in person, some were hybrid, some were self-paced, while others were instruction-led. And some employers also participated in this project where they carved out time for their staff to be able to step away from their patients for an amount of time, take these trainings, engage with coworkers, have discussions, and not take away from their personal time. And that was really, really impactful. The incentive piece for this project was really great. The whole project was really great, but the paid direct care workforce employees were eligible if they submitted sufficient proof of employment as well as the completed training certificates, and we would pay them for completing these trainings. And most of them were able to earn up to $7,500. And so it was a great opportunity, not just to share these free and accessible trainings for caregivers, but to where they can also earn money for taking the time for this. The fourth element of this project is the outreach method. One of the biggest game changers for this project was investing in additional funds for the media campaign to get the word out. There was TV and radio, social media, closed circuit TVs, so such as like pharmacies and places like that, where there was a big push for this project, and we saw astounding numbers of participation. So I think it was Barbara who had mentioned, like, how do you get the word out? Like, that is so, so important. And this big push of the media campaign shows that. So this project was a pilot project. It had not been done by California before. So there were lessons learned, and that was one of the big takeaways. So this project lasted for about 2 years. It concluded last year, but I have a little bit of great news as far as sustainability for the project. While the project's over, we'll be continuing with some of the efforts that came from this. So before I get to that, the next slide, please. I want to share some very exciting impact numbers that happened from this program. So we were able to give out over $35 million to caregivers in stipends and incentives. There were over 33,000 unique learners. There were over 850 courses offered, over 210,000 courses completed. We offered in 10 different languages: English, Spanish, Tagalog, Vietnamese, Mandarin, Cantonese, Khmer, Korean, Samoan, and Russian. So exciting. And the sustainability of this plan, of the trainings. So we are looking at trying to continue. There were great trainings that were developed through this project, and we collected those training materials, and we are hoping to implement them in the future through efforts with the CalCares initiative. So I believe that, oh yeah, before I talk about CalCares though, I did just want to highlight some of the big team members. So thank you, Ranjana, for sharing the website for CalCares, and I believe also CalGrows. So if I can have the next slide, please. Perfect. So the CalGrows team. So this was a very collective effort. This was California Department of Aging, Department of Social Services. That also was the career pathways. They did trainings that very much aligned with the CalGrows program. The difference was the career pathways was focused for caregivers who are in the IHSS program, whereas CalGrows offers the trainings for individuals who are non-IHSS employees. So that are still paid caregivers, but in different capacities. So we also have Public Counseling Consulting Group, USIM, UC San Francisco, which is the Philip R. Lee Institute for Health Policy Studies. We partnered also with the organizations Homebridge, as well as Center for Career Advancement, and also 76 community-based organizations that we included in the project as grantees. So now I can speak more to the sustainability of these trainings for CalCares. Next slide, please. So CalCares is the California Caregiver Awareness Resources Education and Support Program. Okay, next slide, please. Thank you. So a little background on this project. So it did come from CalGrows, which was amazing and fantastic. But this effort also includes the continuation also of supporting Goal 4, the caregiving that works, with Initiative 69, which is to launch CalCares, and Initiative 70, which is to develop and launch curated catalog of free trainings in languages family caregivers and DCWs could utilize. So also, California was awarded an ACL federal grant. This is the Advancing State Implementation of the National Strategy to Support Family Caregivers. And that is just the federal level of the plan that was created. There are multiple objectives, and our CalCares project aligns with 3 of those. 3, I think, of the 5. Okay, next slide, please. Okay, so the CalCares project overview. So the goal is that we wanted to develop, test, and/or scale models to improve awareness, navigation, and educational opportunities for caregivers that aligned with the national strategy that I mentioned in the previous slide. So there are 3 objectives that we came up for this project that cover this goal. The first is increase awareness, and this is awareness of the role, the value, and the unique needs of caregivers. The awareness also of key resources by leveraging trusted community voices and ethnic media partners as messengers. So this campaign for the awareness has 2 pillars. The first is that caregivers are essential, and really to normalize the identity of caregivers because many don't self-identify. The second pillar is, excuse me, the second pillar is empowering caregivers with support and services and promoting what existing referral pathways are available, as well as caregiver support services. The second objective is the navigation piece, and this is navigating the system. So developing strategies to strengthen connections across healthcare and home and community-based service sectors to maximize the caregiver engagement and improve referrals to community-based resources. So this effort also includes mapping what current referral processes are being done. And in this way, we're involving local providers and caregivers and doing informational interviews. So going straight to the source of how these referrals are happening. And this is really going to give us a great awareness of the patterns as well as potential gaps, that efforts that we can maybe focus to do some bridging. The third objective is education, and this is where CalGrow's trainings come into play. So we want to increase access to high quality trainings for caregivers. So the caregiver training materials were collected for CalGrow's. They're cataloged and they're going to be reviewed by an expert panel. And those that have the highest quality rating through the review process, we are hoping to implement into a CDA-based online learning platform where employers of caregivers can use and access and assign for their own staff to support the training for their staff, as well as for family caregivers. And all of that access is going to be for free. So this project timeline is 2 years as well. We are right in the middle of it right now. It is going to be concluding October of next year in 2026. Next slide, please. And there are multiple great things that are going to come from this project as form of products. So we are going to be developing a multilingual marketing and outreach material package toolkit. We are going to have a proclamation for California of the National Family Caregiver Awareness Month for November. We are going to have public webinars, this being one of them, and referral mapping analysis of the 3 target counties that we are doing the informational interviews and mapping for. We're having listening sessions and key informant interviews, and we're also going to finalize with the repository of caregiver trainings and a caregiver guide on how to use and best access and find which trainings are best for the caregivers. Sometimes trainings that are available, they might not know where to start. So we're going to also develop a guide on how to help caregivers in utilizing those. Next slide, please. So the CalCares team, another great collaboration across California's different departments. So California Department of Aging, of course, we are partnering with the Department of Developmental Services, the UC Davis Family Caregiving Institute, Collaborative Consulting, USIM. We are also partnering with 3 counties, Marin County Department of Health and Human Services and the Marin Center for Independent Living. In Imperial County, we're partnering with the Area Agency on Aging and PSA 24. And then also in Sonoma County, the Human Services Department. We've also enlisted a CalCares steering committee, and they're really going to help us as far as checking in with all different pieces of this project, of the media campaign, the questions that we're doing in our interviews, and especially the education materials and the platform and making sure everything is good and it's accessible. And Next slide, please. Thank you. And I did just want to give a quick mention to one other project that we have underway, and this is the ACL State Advancement Lab, also known as the SAL. So this was awarded to California. Although there's no funding that's tied to this, we did and are receiving 250 hours of subject matter expert to help us with technical assistance over 1 year. So this project is going to be ending July of 2026 next year. So the milestone, which is the goal of this project, is basically to develop a caregiver training curriculum that includes materials specifically for DSP, which are direct support professionals who serve individuals with intellectual and developmental disabilities who are aging. So the intersection of those who are aging and those with IDD. And this comes from another MPA initiative, number 65, which is to build the capacity of local agencies to serve the aging and disability community through cross-agency training and partnership. So the partners with this project are the Labor Workforce Development Agency, Developmental Services, as well as the California Community College Chancellor's Office. And we've also enlisted a group of an advisory panel to help guide us in this work as well, so that we can ping and utilize local experts in curriculum, as well as serving aging individuals, caregivers, and serving individuals with IDD. So we are hoping the sustainability of this project to be as far forward as we can. So we've actually built into this project next steps for once this development of the curriculum is finalized, how do we then implement it to the public? So we're very excited about that. And I'm really, really hoping that we'll be able to make it public in fall or winter of 2026. And that is it for me.
If we can have someone unmute the meeting room, that'd be great.
Okay,
There we go.
There.
all right.
Sounds
We're opening up the questions to committee members. If you have any questions or comments, please raise your hand or hop in.
I'll just quickly ask Teresa. We were at the C4A meetings yesterday for California Commission on Aging. On the C4A, obviously, there's a lot of panic about funding cuts. And this program, the first program you mentioned, ends in October 2026. So I suppose there's no backup plan to continue that thereafter, because there may be lack of funding. And I think one of you mentioned 76 grantees were local agencies. And maybe there's a way for semi-self-sufficient niche local organizations serving aging communities to partner with and diffuse out the funding a little bit, and then less reliant on federal funds as such. So I'm not sure if you guys, are discussing those strategies now, or it's too early for that, but that's what I saw yesterday, a lot of panic.
Yes, there is a lot of panic. Luckily, we already got the money for it. So effort is underway. We are doing it for the timeline, because that is what we were approved for the project from the federal funding. So from there to continue, we would just kind of like see what available opportunities for new additional funding if we wanted to expand further on the project. So it's very much, and I think that you're talking about the CalCARES project,
Yeah.
right? Yeah. Okay. So so we are in the middle of that right now. We'll be completing next year. And then from there, we'll see, the findings from that project and the best way to move forward after we get those. There are the grantees at the local program, at the local level. Some of them are still continuing to offer their trainings, which is amazing and fantastic. And on our CDA CalGrow's website, we actually have some of those trainings still posted and hosted for anybody to access. So I believe that Ranjana had posted the CalGrow's website. So thank you so much for doing that. And you're welcome to go there, and anybody can go there and take a look at what the trainings that we do have available as of right now. And then once we get all the other trainings reviewed and then ready and up and running, that will be implemented hopefully next year. And I see Anna has her hand up.
Thank you for the question. Can you hear me?
Don't give Carol.
Project, Anna. Can you project?
Can you hear me? I can talk really loud if you need me to.
Yes.
Okay. Yeah, thank you for the question. I just wanted to add in that, we are always thinking strategically about sustainability for all our projects. The Cal Grows trainings, ideas, they will continue to be made available through this current project. And then I would say for Cal Cares, we really want to use the information gathered to help us with future work around No Wrong Door, around navigation. We really want to use it to help inform our decision makers here at the state and with our partners of how we improve those referrals, that navigation between healthcare and social service providers. So thank you for the question.
Thank you. Anybody else have any questions or comments? Oh, Jason.
Hi, thanks. Great work, great presentation. I was curious about how the team plans to do the guide. So, we struggle with this a lot. Like, how do you curate this? Do you envision written documentation, video curation, interactive stuff? How does the team, or has that been decided for the guidance on the existing trainings?
Yeah, that's something that we're trying to figure out currently. So great question. Thank you so much for that. So our vision as of right now is making it an interactive platform where there's like filtering that's available, search features where people can search by specific topics or roles or conditions, and then developing a written material, something that's very easy to follow for the caregivers accessing the programs that they can then reference. But this is also something that we are going to be developing with our steering committee. So these are just our ideas that we have right now. And then once we get to that point, then we're going to be engaging them and seeing what works, what doesn't, what would be most impactful. So it's not official yet what that will look like, but I'm happy to keep everybody still informed about what that does once we wrap up the project.
Great. Anybody else? I think we had some really good questions and comments. I just want to thank you, Teresa, for your informative presentation. To close this segment, we'll hear from Dan Salinger, a family caregiver who will share his personal story and reflections on caregiving for a loved one with dementia. Dan, thank you for being here and for sharing your experience.
Well, thank you, Carlos, and it's good to see you again. And I'd like to say thank you to all the committee members for taking the time to listen to this story. It is not an extraordinary story. In fact, it is exceptionally ordinary. I think it's very common, and I think therein lies the value of my caregiving journey. And I will tell you, my caregiving journey began long before I had anybody living in my house. I'll go back about 10 years. Currently, my dad is he's 93 years old. He's currently living in my house. We recently had a broken hip, and we've been recovering that since last March. And it's been a long journey, and we are still on it. But I'm going to jump back. If you like, I can take the camera out really quickly and just give you a quick introduction to my dad. Let me just do that. So I apologize. I'm going to be walking through. We have a ABC News here, so I'm going to be walking through that. They're doing a story. Excuse me. I just want to. Hello. Sorry. I'm just going to show you what we're talking about here. Hang on, Mark. I just want to introduce my dad. Dad, take a look here. I want to introduce you. we're talking to a committee within the California state government, Pop, the California Department of Aging. And they're to my story regarding you, and maybe you can help other people in the future by sharing your story, Pop. What do you think? You want to say hello?
Hello.
All right. Thank you, Pop. I'm going to go get on it, okay? I just wanted to put a face to the story because this is, if anything, it's an incredibly human story. And the caregiving story starts long before he moved into our house. And I'll share a couple of incidents that we had to deal with. But, I'll go back about 10 years. My dad was living independently in a Del Webb house in the same city that I live in, same city that my brother lives in. And of course, the symptoms began. We had major episodes long before he ever moved in with somebody. Symptoms started to appear. Things like I'd be following him on my phone and watching him. He'd hit an intersection that he's navigated through 1,000 times before, and he'd turn the wrong way. And I'd call him up, Dad, where are you going? I don't know how I got here. He'd turn around and he'd get back. We've had an incident where during that period where he came into my house, and there was a room that he had been in hundreds of times over the last 5 years. He slept, took naps in that room, and he walked in and said, "Oh, you added on a room." Very shocking. And another experience, very out of character for him. He was carrying around a cashier's check, a large sum of money. He had closed an account somewhere, and it was just in his wallet. By the time I discovered it, it was already 3 or 4 weeks old. It was ripped and bent. And if that had fallen out, nobody ever would have known. It just would have been lost. And these are all incidents that are occurring while he's living independently on his own. And I think the most significant is the car. And I think this is incredibly common. At some point, there you have to deal with driving. And in my dad's situation, it came about because he got a red light ticket. And I looked at the ticket and as a lawyer, I looked at my dad's in the number 3 lane, and he appears to have a solid green light. And so what's the ticket? I went to court for him. I showed the DA the ticket, and we looked at it. And then we went back and watched the video. There's 10 or 15 seconds of video that's connected to all of those tickets. And sure enough, my dad was in the number 3 lane, and he had a solid green light to go forward. But unexpectedly, in the middle of the intersection, my dad decided to make a left turn and cut across oncoming traffic, narrowly missing huge accidents with 2 or 3 cars. And he just sped right through. I mean, it was like that Frogger game, trying to cross the street. And it was incredibly disturbing. And the DA, I looked and said, this guy cannot be driving. We worked with the judge and the DA with the DMV. We got his car taken away, or his driver's license taken away, excuse me. That did not end it, because we locked his car up, put it in his garage, taken away his keys. But the man seemed to have an endless supply of spare keys, and he kept driving the car. And finally, we moved it to my mom's house. She also lived in the same community. They were divorced 40 years ago, but ended up living in the same retirement community a couple of blocks away. And so we moved the car to my mom's house. Well, my dad walked by that car, went back, got one of his 5 million spare keys, and took the car out of my mom's driveway. And he hadn't driven in 6 months. He couldn't drive 6 months earlier. Now he had no insurance. It's terrifying, right? And all this is happening while he's living independently on his own. And the fateful day came. I woke up. Like any other day. I didn't think anything unusual was going to happen that day. And my brother and I are with my dad, and we see that he's got a bruise. He's got some cuts here. He's been bleeding. And what happened, Dad? I don't know. And that was the final straw. That was the day that my brother and I are imagining him laying in his house with a broken bone or something for 14 or 15 hours before somebody discovered him. And that was the day we decided he's going to have to come and live with one of us. And my brother had recently been divorced, so that's perfect. That day he moved in with my brother Mark, and it was great. Everything was happy for about 6 months, and it was working great. except my brother was starting to burn out. So 6 months went by, and he had to go visit. He had to take a vacation, get a break. He went to visit my sister, and my dad came to live with my wife and I for a week. And it was during that week that that we discovered it was just too difficult for one person, especially my brother. He's 8 years older than me. And from that point on, we started just to do the switcheroo. And he would stay with my brother for 3 days, and he'd come and stay with us for 3 days. And that worked pretty good for a couple of years until the symptoms became more pronounced, and the switch became very difficult for him. So at that point, my wife and I decided, in discussions with my brother and family, he would come and live with us full time. And he's been with us full time for about the last 2.5 years. And during that period, at the beginning of that period, my dad was ambulatory. He could walk into the bathroom, he could walk into the shower. We'd help him dry him off, but he was pretty much independent living within our house. He could eat alone, he'd get up, do his thing. And then, unfortunately, last March, my dad took a fall. 5 a.m, he's getting up to go to the bathroom, and he fell. My wife jumped up to go deal with it, and a second later, she's screaming for me. So I run in, and sure enough, my dad's fallen and broken his hip. And again, you don't expect anything. It's going to be a normal day, and it turned out to be another major life change for me as a caregiver. We went to the hospital. He had a hip replacement, and I'm becoming educated on just how serious this is for a 93-year-old man with advanced dementia. It's not a very rosy prognosis. And, we decided we're going to give my dad the support. And if he chooses to fight on and make it past, we're going to enable him to do that. And sure enough, my dad is a tank, and we are still living. And now he is much less ambulatory. He needs help in the shower, and it's completely. He needs help going to the bathroom. He needs help getting up in the morning from the bed. We walks with a walker to the kitchen table, and he walks around the house with a walker, but always with somebody there holding on to him. So, and before the fall, we could take him in the car. He could walk out. It wasn't quite as severe as what we're going through now. We had a pretty we could pretty much live our lives. Since the fall, it's quite different. And we're dealing with that, and we're moving forward next week. We're not giving up. He has a procedure next week that hopefully is going to get his catheter out, which will allow him to have a little better quality of life for his remaining time on this earth. And that's, you kind of fall into this caregiving thing. I never planned on being a caregiver. It was just something that slowly happened, and you take on more and more responsibility. And then, ultimately, if they live long enough, you're in a situation like me, and you're dealing with somebody with pretty significant issues. And I am so uplifted by just watching some of what's going on here with you guys today, and to realize that there is a major effort to help people that are in my situation. And I want to thank you all for what you're doing, because it is very, very needed. Caregiving is really hard, but really valuable. And in closing, then I'll take some questions. I just want to say, family caregiving is the toughest job that I've ever had. I've never undertaken anything more difficult, but it's also the most rewarding, and the experience has made me a better person. I honestly like myself a lot more now than when I did when this journey started. And I truly believe that society as a whole benefits when families are enabled to care for an aging loved one in the home, surrounded by their family. And I can open it up to take any questions. I don't know how many gaps I put in there, but if you have any questions, I'm happy to respond.
Thanks, Dan. Questions from committee members? Claire?
Yeah, I don't have a question, Dan. I just wanted to say thank you for using your voice to elevate the needs of caregivers to the general community, and frankly, for helping to normalize this journey that so many are on, and so many people feel isolated, and you help them to not be isolated just by being open and honest and sharing the highs and the lows of the journey. So I just wanted to say thank you for all that you're doing.
Well, I very much appreciate that. And I don't know if you're aware, I've been sharing my journey on social media. So we've had a lot of followers that have been following along. And that has been a really rewarding experience. The overall mission of that channel, by the way, is not necessarily just to showcase dementia and how you deal with it, but to show that that a family can take in a loved one with dementia, bring them into their home and care for them and meet all of their needs and still be able to live a semi-normal life and productive and happy life. That's really what I'm trying to share with the world. It is a wonderful experience. And I hope that the channel brings more people in and causes more people to take a shot. I never, if you asked me 15 years ago that I would be doing this, I would have laughed you out of the room. There's impossible, but it's not only possible, it's rewarding and it's a wonderful experience. Thank you for that.
Thank you, Dr. Mobley.
Dr. Mobley?
Yeah, hi, Dan. Really, really a very touching story, and congratulations to you and your family for doing so well and being so really helpful and kind and caring. Uh, what do you know now that you wish you had known when you began this journey?
That is a long list, Doc. And I think, that's one of the things is that people fall into caregiving without any preparation, without, obviously if the people that are on it and, that are organized don't have ADHD, they may be a little more prepared. But, I've learned that, I've learned that this is that the process of caring for somebody else is so beneficial to the caregiver. It opens up a door to a world of empathy. When you're dealing with someone with dementia and they can't necessarily articulate what their problem is, it forces you to jump into their body and try and figure out, based on what they're doing, what their issue is. And that carries over beyond caregiving and in the rest of the world. When I see other people dealing with kids, problem kids, or an autistic kid, I look at that completely different today. And I had no idea that caregiving was so two-way, that it was a two-way street. It gives you back almost as much as you give in. I've also discovered that, life is not doesn't necessarily follow the path that you anticipated or that you thought, and that life is full of changes, and that things can happen in an instant. Your life can change. And I know people that have been in a bad car accident or heart attack, strokes. It happens, but until it hits you, you don't really understand it. And caregiving has just made me grow as a person, and totally unexpected. And there are benefits to caregiving. Those are really what surprised me going into it. And I think it's a wonderful thing that other people should, if you have the opportunity, I think it's a great thing to explore.
Very uplifting. Thank you so much, Dan.
Thanks, Doc.
Anyone else from the committee? Well, Dan, I am touched. I've been following you for a while on social media. You're an inspiration to me as a male caregiver, and seeing all the males in your family. It shows the power that we can have as partners in this care journey. I just want to thank you for your powerful story, for your advocacy on behalf of caregivers across California. One last question. Where can people follow you on social media?
Carlos, first, I have to say, right back at you. Everything that you just threw at me applies to you, sir. And thank you for what you're doing. A lot. We run into each other because we're in the same circles doing the same thing. And you are amazing. Your dad's amazing. And thank you for doing what you're doing. And you can find my journey on TikTok under DSAL NorCal. You can just look up Dan Salinger and usually you're going to get there. But we're on all the majors: TikTok, Facebook, Instagram, and YouTube. And you can search Dan Salinger and you can find those. It's quite a journey. It's quite a thing to look back at some of the early videos. And I'm wow, a lot has changed in the last 5 years.
All right, we have one last question from Anna.
Hi, Dan. Thank you so much for joining us. And my question is, has Ed found his checkbook?
Yeah, we've located it at Mark's, actually. It's been there all the time. You know, the checkbook is something that was something that was repetitive. You know, if you want to see repetitive, you can hear my dad ask for his checkbook in like 5,000, you know, sequential videos. And he's still looking for his keys, though. So that's a good sign.
Yeah, that's great. I resonate with the driving portion because I've had to take the car keys away from my dad and strategically navigate him into a pattern of letting us drive for him. So thanks again, Dan. Thanks again, Dan, for being here and giving your story.
Well, thank you, Carlos, for everything and hosting, and thank you to the committee members for listening.
All right. Next up, committee updates. I will now provide a few brief committee updates. First, we're moving forward with targeted recruitment for 2 new committee members who are individuals diagnosed with Alzheimer's or related dementia. Including voices of lived experiences is vital to the work we do. All new members will begin their terms in early 2026, and we look forward to welcoming them at our first meeting next year. Finally, the 2026 meeting schedule has been finalized, and invites will be sent by the Master Plan on Aging team prior to the end of 2025. There's a typo here. Okay, so 2026 meeting schedule, Thursday in February, May, August, and October, 10 to 1 p.m. That's going to be 3 hours. February 5th, May 7th, August 6th, October 29th. Additionally, beginning in 2026, committee meetings will be shortened from 4 hours to 3 hours. This adjustment will help us stay focused and efficient while ensuring robust discussion. Just a note, in-person attendance is not required. However, it is wonderful to have committee members attend in person to foster engagement and collaboration. For those who are unable to join us on site for the virtual participation option, we will be available to ensure full accessibility and inclusion. Going from 4 hours to 4-hour meetings to 3 hours for 2026. So we're moving on to public comment. Thank you for all the presenters for such an impactful morning. We now open the floor for public comment. Carol, I'll hand it over to you to start our first public comment.
Thank you, Carlos. I appreciate everybody's time, and it's been such a great meeting thus far. Thank you to all the presenters. Learned so much. This is our public comment period. If you would, for those of us, any attendees in the room, feel free to raise your hand and one of the CDA staff will call on you. And for anyone on our Zoom platform, you have a raised hand icon that you can use, and we will unmute your line, and you can give your public comment. And of course, at any time, if after this meeting you do have a comment, you need a little bit of time to formulate those thoughts, please email us at engage, ENGAGE, @aging.ca.gov. Anytime, we monitor that throughout the day, 5 days a week. Note our public comments are limited to 2 minutes, just so we can make sure we have time for everyone. We are seeing if anybody would like to have a comment, would like to share a comment. This would be the time. We also have another public comment opportunity later in the agenda after the break. So this is not your only time. Again, at any time, you can send your written comments to engage, ENGAGE, at aging.ca.gov.
Public comment you put in the.
All right. There is a comment in the chat. I would love to talk with you more about unique issues that male caregivers face. Seems like we don't know a lot about differences in how men and women do caregiving. Would you be interested in that? I think that goes out to like somebody like me, right? Yeah, I'd be open to talking about it. I'm pretty sure Dan, I'm going to speak for Dan. I'm pretty sure he would like to talk about it.
I guess, thank you. I guess I'm wondering what would be the forum or format, or, how could we have more of an in-depth conversation about some of the key differences between how men and women do caregiving? Because they do it differently. I think we know a lot about women caregivers, daughters, spouses, and various other relationships, but we don't know much about men, in my opinion. So how could we get, or is there a vehicle for getting more of a conversation going on that topic that would include you all who presented today and gave such beautiful examples of what male caregiving involves?
Michelle Nevins put into the chat, Del Oro Resource Center has a men's caregiver support group on third Tuesday from 2 to 3:30. I know for myself, I Zoom in to a South Carolina caregiver support group that is a men's coffee group with Eliza's Care Connection. I know Hilarity for Charity has done a live session with men in caregiving. I know that there's possibly other organizations that are going to explore the need to highlight men in caregiving. I myself host a men's support group where we talk about men's mental well-being and mental health. And I'm probably going to try to maybe explore expanding that to male caregivers. But we do need to highlight what men go through. There's a lot of expectations for men. There's a lot of ideas that men have that women don't. And it's just not to take away from them, but we also need to collaborate and partnership with our female counterparts and learn from them. I myself have learned a tremendous amount of knowledge from others in caregiver support groups that has impacted my journey as a male. I think we need more about it. We need to highlight us, and we need to empower men to be partners, not just the primary caregiver. We need them to support the females that are on the front lines as well, the brothers, the uncles, the husbands. We need to understand this
Yes.
on a water scale.
Yes, I totally agree with you, and I thank you for picking up on the comments. I just wonder, is there anything the Department of Aging can do, in light of the work we've heard this morning? We've heard so much innovative work going on. Is there any particular attention devoted to this topic, or could there be in the future? I'm not sure who to ask that question of. So
Yeah, I think we're gonna maybe discuss that and maybe make a recommendation to that.
Okay, that would be great if you could remember. I'll try to remember later when we get to do the recommendations, but if I don't, I hope someone else will pick up on it because I think it is important. And if I could just say one more thing, and that is that I think we're coming to the realization that caregiving is really a family affair. We have, yes, a primary caregiver often, but they are not the only ones affected. As we know, by dementias, the whole family is affected. So I'm hoping eventually we can move more in that direction of looking at the family unit and how to support the family unit as a caregiving essential to the caregiving experience. So.
Absolutely. Barbara, you have a question or comment?
I just wanted to note, I mean, there is an awareness among service providers like my own Alzheimer's Los Angeles about the need for support for men who are caregivers. I see that Michelle put something in there about how the Del Oro Caregiver Resource Center has a men's caregiver group. We have a men's support group. We have support groups that are actually for men within specific communities. So I do think we're not starting from zero in an understanding of the issue. But it's, certainly there's always a need for more support for everybody who's providing care. Thanks.
Thank you, Barbara. Anybody else?
I think, sorry, this is an additional thought. There is a bit of research. I think the Alzheimer's Association put out in their facts and figures a few details broken down by demographics of people providing care, though many of these are professional. So it's hard to know, the specific question about family, which I think is really what the subtext of the question is. But there are some helpful data points that could be discussed in a kind of a clear way to guide some of the discussion points about who's doing what, how is coping going, that kind of stuff. That's surveillance across the across the country.
Great point, Jason. Appreciate that. Anybody else? Room? All right. I think we're moving along, right?
We could put up the public comment slide just one more time and just to see if we can, if anyone else has decided to give a comment. So just a reminder, you have, if you're on Zoom, you have a toolbar that is the raised hand icon, and we can unmute your line. And of course, at any time, if you want to send written comments to the committee, you may do so at any time at engage, ENGAGE, at aging.ca.gov. Anytime, we're happy to take those. But I think that we are concluding, Carlos. No further public comments. So we can close this out.
Great, thank you. Next, we'll take a 30-minute break. 45-minute break. Been corrected. All right, and we'll meet back at 12:45-ish. So we'll see you soon.
Thank you.
All right, welcome back, everyone. I hope you had a chance to stretch during the break, and thank you so much, Carlos, for facilitating the morning part of this meeting. We have a change in our agenda today. We will actually begin with the legislative updates portion, and the state updates will be done around 1 p.m. So please welcome Barbara McClendon, our public Policy Director of Alzheimer's LA, and Mendoza, who's here with us in this room, Director of State Affairs at Alzheimer's.
Thanks, Wynn. I think there's some slides. So we want to start the slide.
Yes, hold on. I will check with our slide projector and we'll get that going for you. Hold on, Barbara.
Sure, no problem. And I can do it without slides if need be.
Our slide person is there and getting adjusted. But if you want to begin, she will catch up with you. Oh, here we go.
Okay, great. So this time of year, the legislative update is always a little bit shorter because we are reporting out to you on the results of the legislative session that just finished. And action hasn't really begun for the upcoming session. Lots of conversation about what we expect we might see, but nothing concrete yet. So next slide, please. I'm going to speak about 3 bills, and then Andrew's going to follow up and share with you several more. I'm going to talk about 3 bills that did pass. So there are many that I shared with you earlier in the spring, and they did not make it across the finish line. So we're not talking about those today. I'm happy to report that AB 960, which was Alzheimer's Los Angeles, Alzheimer's Orange County, and Alzheimer's San Diego's priority legislation this past session, did indeed pass and was signed by the governor. What it does is ensure that someone with a disability that would include cognitive impairment, but actually the bill got expanded through the session to include other populations, will be able to have a caregiver, be they family or friend, with them throughout their stay in a hospital setting unless they are in the way in some way of the delivery of medical care. So this is nice because while we did always believe that the Americans with Disabilities Act provided this protection for families, sometimes it just was difficult for families to advocate, or friends who were caregivers to advocate for themselves in these sorts of settings. So we believe with the passage of this legislation, which makes it so clear, it will help families be able to more effectively advocate if they are asked in a hospital setting to leave, to be able to say, you know, that they have the right to stay. So we are working on a fact sheet on it now that it has passed, that we will be sharing again all about educating caregivers and providing them with more tools to be able to care for their loved one. Next slide. Oh, okay. Hopefully the next slide has the other bill that I'm hoping that I really was excited to. I'm excited to talk about this one too, but the other one I'm very excited about. So this one is really important because, you know, what we experienced in Los Angeles at the start of 2025 with the fires, and made so clear that we have to do a better job protecting all the members of our community in an emergency situation. And so what this bill would do is direct the county welfare department to put together a memorandum of understanding, could be with their area agency on aging or the independent living center or that aging and disability resource connection center. What it exactly looks like would differ, you know, county to county, to ensure that there is a shelter that's been identified. So people who have needs could be evacuated to that specific shelter and be able to continue to get services that they're relying on. So this is great. Hopefully will result in counties doing a better job planning and preparing for what we know. There is always going to be the next natural disaster. And so hopefully we're going to be better prepared when that arrives. Next.
Barbara, it appears that we do not have another slide.
Okay,
so
let me just verbally, this is Senate Bill 590, and this one, we're really happy that it did finally pass and was signed by the governor. It made a run the previous session and did not pass. So what this will do is expand the paid family caregiver, the paid leave program to people who are friend caregivers, basically operating like family members. So instead of limiting access to the program to people, because the original language related to the program outlines specifically which blood relations would be able to access paid family leave, this broadens it out. And families come in all shapes and sizes, as we know, and so this is really a very, very important, and we hope will allow more people who are providing that really important care to be able to take advantage of paid family leave, and hopefully make it more possible for them to take time off from work to provide that care when it's needed. Now, there were amendments to this bill, which mean that it does not become effective until July 1st, 2028. Which feels like a really, really long time from now. But in the interim, what all of us who've been supportive of this legislation are going to be doing is building the tools so that we make sure to educate people about the program's existence. The vast majority of people that take advantage of it are people who have had a baby or adopted a baby. And so there is a lot of work to be done to educate caregivers that this is paid family leave is something that's available to them as well. And I believe I'm handing it to Andrew now.
Andrew Mendoza, the Director of State Affairs for the Alzheimer's Association. You can move to the next slide. You can move to the next slide.
So Andrew, we could barely hear you. So whatever, I don't know if you could sit next to, yeah.
It's going to be this.
I think I can just, does this work better?
That is better.
But not good?
That's okay. Okay, I think that'll work.
Sounds good, Andrew.
So this is our sponsored bill. It's SB 412 by Senator Lamone dealing with home care aides. So it builds upon their existing training requirement. Each home care organization has to do 5 hours of training on a series of different topics. And this bill just adds on dementia specific care to that list. And we thought that this was necessary so that anyone providing care to clients with dementia will be able to fully understand complications with activities of daily living and will be better at working with those clients going forward. So we can move to the next slide. So this, oh, I forgot to say, I'm sorry. Our sponsor bill was signed by the governor. All of the bills that are in my slides are signed. So SB 470 does affect the advisory committee. It enables state boards and commissions and advisory committees to meet remotely. It does extend the sunset on those provisions. So the senator had set out to make them permanent. So he'll likely be able to do that before he leaves the legislature. But this does extend those provisions for now. And the Little Hoover Commission did do an analysis of this policy and provided that it improved participation for state boards and commissions and that it saved the state money overall. So it was opposed by the ACLU and the Newspaper Publishers Association, who had staked out a strong position on the Brown Act. This is the Bagley-Keene Act, so a bit different, but that opposition stayed strong in their positioning. So it was sponsored by the California Commission on Aging, and it was supported by other aging and disability groups. And in part, it enables caregivers and people with disabilities to serve on decision-making bodies and provide their perspective. So that bill has been signed, and we can move to the next slide. SB 530 by Senator Richardson. This bill extends network adequacy standards on Medi-Cal managed care plans until 2029. It would not absolve those plans of time and distance standards when they offer telehealth services This means that enrollees will not have to travel long distances or experience prolonged wait times to see a provider or certain specialists. Included in the existing statute is neurologists, which was of particular concern to us. They had added additional specialists that got taken out during the policymaking process, but that one was untouched. So these provisions will be in effect until 2029. I do believe that she had also set out to make these provisions permanent, but ended up with a sunset extension. But that is now signed, and I'm sure it will be revisited in the future. If we can move to the next slide. SB 250 by Senator Achoabo. This one just requires the Department of Healthcare Services to include skilled nursing facilities in their provider directory for Medi-Cal plans. This provides individuals and their caregivers with an accessible way to view options covered by their insurance when creating a care plan. At the assembly hearing, they explained that the current situation provides enrollees with an unsearchable option with many different pages associated with it. So when they print out the PDF, it could be a large stack of paper with thousands of pages and many options. And then the coverage would not be totally clear to an individual when looking at those options. So they would have to suss that out. And this provides a more accessible way for them to look through options. It did not have any opposition on it. So it sailed through and it is now signed. We can move to the next slide. AB 1495 by Assemblymember Valencia on home health aides. This bill was signed as it was introduced and not amended at all along the way, which is rather unique. But it's my understanding that the department did ask for this bill. It does provide parameters for online training and distance learning and in-service training for certified home health aides. It also expands the list of eligible instructors for these training courses to include both registered nurses and licensed vocational nurses. And this helps to build up the state's capacity for home-based services, especially as the aging population is increased. So we really were excited to see that Assemblymember Valencia took on the challenge and led the way for the state to help build up that capacity. We did support this bill, and they had asked us to provide some testimony for it, but ultimately it was on consent all the way through and did not need to be presented before the legislature, and it is now chaptered. We can go to the next slide. And I believe this is my last one. It's AB 561 by Assemblymember Cork Silva relating to restraining orders. This bill harmonizes provisions relating to filing fees, remote appearances, and alternative service in civil harassment protection orders proceedings and the same proceedings under Domestic Violence Prevention Act and the Elder and Dependent Adult Civil Protection Act. It prohibits the charging of fees for filing or remote appearances in those proceedings. And the intent of the bill, from speaking with the sponsors, was to provide more equity for older adults when seeking justice and finding where there wasn't parallels in the existing law for other individuals. And this bill has now been chaptered, so it is law. And then that is the end of my presentation.
Well, thank you so much, Andrew and Barbara, for sharing your legislative updates. I think we have Susan now. Is she on? Oh, great. So we'll move on to our state updates from Susan DeMorris, Director of the California Department of Aging.
Thank you. Good afternoon, everyone. Good to see you gathered in the room and on the screen. I hope you've been having a great meeting. I'm joining you today from Orange County, where the California State Association of Area Agencies on Aging, C4A, is holding their annual conference. They've got about 450 people gathered, and I can tell you every single presentation has mentioned Alzheimer's, dementia, and caregiving. So it's just great to be in an audience of the 33 area agencies on aging in our state, the caregiver resource centers, the independent living centers, the regional centers, and a lot of our partner organizations, including the Alzheimer's Association groups and Meals on Wheels California. So you're being thought of today. I had just two quick updates for everyone. I don't know if it's been shared yet, but today, in honor of our meeting, the governor did issue his proclamation acknowledging and recognizing Alzheimer's Awareness Month today. And I'm so happy to share that with you. I hope it's been shared in the link. I hope you'll promote it. And I just want to provide just a little bit of background that this is something that our governor's office and our team in the governor's office really takes great care in crafting the message and making sure that it really meets the moment where we are today in our state, and that we lift up things that we're very proud of that are happening in California. So it's for all of you that it's being recognized today, and I'm very proud that we're that the governor's proclamation's been issued, and I hope that you'll share it widely, as we will do. It's now just, I think, about an hour old. I also wanted to share that let's see, this would have been the last day of September. So part of the process for the Department of Aging is every 4 years, we're required to update our Older Americans Act state plan. And this was one of the years where we were required to do that. We submitted our updated plan to the Administration for Community Living. It needed to be approved by October 1st. There's been a lot of transition in Washington, a lot of change at the Administration for Community Living. This is one of the agencies that's been impacted by the Department of Government Efficiencies. They've reduced the staff by half. They've moved it to another agency, but our state plan was approved on the last day of September, and we're now operating with a new 4-year horizon, 2025 through 2029. And what I wanted to mention to this group is we're still learning the new administration. And in our plan, they specifically called out our work with family caregivers. We know that that is the top priority today with the Administration for Community Living and part of the U.S. Health and Human Services Agency. So we were pleased that we got that recognition, and I wanted you to know that that's something we're proud of and we're doing. We've been recipients of federal grants. We have a lot of activity happening in the caregiving space between our area agencies on aging, our caregiver resource centers, and with our partners around the state. We're really, one of our federal grants allows us to uplift the training from CalGrows and to make that training available to both paid and unpaid family caregivers. So we're really excited about the work that's underway there with some additional federal grant support. Anna, who's in the room, is leading that for us, and she can fill you in on more, but we're excited about that work. And we're also partnering with UC Davis, the Family Caregiving Institute, and they're our partner in that work to really make sure that we align with the national strategy on family caregiving, and that we develop, as part of California's master plan, our own state caregiver equity roadmap, which is underway. So while today the governor acknowledged National Alzheimer's Awareness Month, we expect him also this month to recognize National Family Caregiver Support Month, and expect to see more on that. So these two are linked, and those were the only updates that I have, unless anybody has questions for me.
If I may, Susan Faisal here. Our Commission of Aging met yesterday at the conference, so we miss you. I think some folks might still be around.
Yes.
You're right. There's a lot of talk about funding, a lot of talk about caregiving. And we also, at today's meeting, we had a presentation by Caregiver Resources Center group. And one of the lingering issues, and I was wondering if the department can study this, is the wait lists seem to be getting longer and longer, and that might turn into a crisis situation if funding continues to decline. So if we can get a survey around the state to see what the wait lists look like, and see if there's strategies to work around it, to enroll some more patients and families in it, that would be great help.
Thank you. That's a great suggestion. We'll definitely take you up on that. Thank you. I hope you've also had a chance to meet our new dedicated designated staff member, Brian, who will be leading our Alzheimer's work, who's been working behind the scenes with this advisory committee, but now permanently, and I couldn't be happier to welcome Brian into this role. I think Brian's there. Can't see.
Yes, thank you. Thank you,
Oh,
Susan.
there you are, Brian.
Looking forward to this role and
Your audio.
You sounded good, Brian. Go ahead.
I just wanted to say thank you, Susan, and really looking forward to being a part of this important, prestigious committee. So thanks so much.
Yeah, we're glad you're here. And you might also be hearing a little bit about CDA's work to implement Senate Bill 1249. This is part of our California 2030 work. I think some of you have joined some of the public webinars that we've held. We've done about 3 years of research and stakeholder engagement, and over the next 4 years, we'll be making some modifications to our Area Agency on Aging network. We're going to really be focusing on core statewide services, the first being information and assistance. We really feel so strongly that that's the front door to our No Wrong Door system. And that's the one area we hear the most complaints from older adults, people with disabilities, family caregivers, providers about not knowing where to go, where to start. So really strengthening our information and assistance that we provide in all 3 AAAs. The second area would be senior nutrition. These would be home delivered and congregate meals. That's far and away the largest program that every AAA provides. They serve the most people and they receive the most funding for senior nutrition. And then the third area would be caregiver supports. So we're excited to be working with our AAA partners on those 3 statewide services. And we're also going to be looking at how we can update their funding formula. And I mentioned how pleased and proud I was that we got called out for our caregiver work in California, but we also got dinged because we haven't updated our intrastate funding formula in over 30 years. And during those 3 decades, the population in the state has changed and shifted. And so we need to make some adjustments there. And then finally, we're going to be tightening up through the regulatory process how a AAA becomes designated and de-designated when there are concerns. And we're also going to be affording
Yeah, that'd be good.
opportunities.
So Haley, I looked at the reviews.
Oh, there we go. We're going to be also looking at how planning service areas, how the map is drawn and the geography that each planning service area covers. More to come on that.
Carol will now open the floor for our second public comment period. So I'll hand it over to you, Sarah. Our second public comment.
Let's put up the public comment slide. This is our public comment period, the second on this agenda. And I can go ahead and verbally go over. For those attendees via Zoom, you have a raised hand icon. you can click on that and that will indicate to us you have a comment. Anybody appearing by phone, *9. And then, of course, at any time, you can send your written comments in, and we will be sure to share them with the committee. Written comments can be emailed to engage, ENGAGE, @aging.ca.gov. And we're happy to send those along to the chairs and the committee and share them where needed. Lots of information today. So if anybody would like to give a public comment, this is a great time. Otherwise, we're happy to take your comments later through the Engage email box at engage, ENGAGE, @aging.ca.gov. I think we don't appear to have any public comments. Lots of information. I'm sure it's stewing around. So I turn it back over to you, Wynn. We can't hear you, so maybe when someone can unmute the room. Yeah, yep, we can hear you now.
All right, excellent. Thank you so much, Carol. Hopefully they'll email us for more comments and feedback, since we really value value everyone in guiding our community's work, especially as we enter 2026. So we'll now review and finalize our recommendations for our secretary. Carlos and I will guide this discussion and ensure everyone has an opportunity to provide input. We had some. Oh, can you hear me?
Yeah, but you're really quiet.
Start over. Okay. All right. So I think I'll just review some of the recommendations made this morning and then I'll pass it on to Carlos. So Barbara had mentioned older adult funding protection and early intervention, and Michelle Levine's earlier also recommended convincing LA County to change their mind on removing respite and supporting the Mental Health Services Act. Dolores also mentioned would like further discussion in relation to the differences between being a male versus a female caregiver. I'm definitely interested in that. And Carlos, would you like to add more?
Yeah, as part of my recommendation, like it was brought up, men in caregiving, highlighting that, how we can explore the differences and how we can best support, trying to project this way and that way at the same time. How we can both kind of understand the differences between men and caregiving, and how to encourage better partnership with men. And then another recommendation that I feel is that we need to understand how to support the CRCs in funding with grants and how to provide more support for the family caregivers through those organizations. I think, it was brought up earlier that there is some funding that's been cut. So as a body, how do we move forward and identify those gaps and proceed forward? So if anybody else has any recommendations that they would like to elevate, now's the time to kind of speak up. And I think I see Barbara.
Yeah, I just wanted to make sure that what's communicated to the secretary around the loss of respite community support benefits is clear. So when you're putting the letter together, because this is a little bit of a in the weeds issue, but it has very big real world impact. Don't hesitate to reach out to me and I can clarify or provide language or be helpful. to make sure that that's communicated accurately. And then just a question, are we going to have an opportunity to put forward ideas for presentations or topics to be covered at future meetings? Okay, then I will hold my thoughts on that. Thank you.
All right, Dr. Mobley.
Yeah, hi. Thanks, Carlos. Dan is still on, and I just wanted to build on Dan's comment to say that there's real value in training caregivers around the concept of empathy and compassion. And that most training programs don't really emphasize that. But what Dan's own comments pointed to the importance of empathy and how his ability to engage with his father enhanced his empathy and very likely enhanced the quality of his life and his caregiver experience. So I would like to recommend that consideration be given to training specifically focused on enabling caregivers to understand and practice empathy and compassion.
I agree, Dr. Mobley. A lot of that I've had to learn on my own. And it's kind of a struggle when you're trying to balance caregiving, your own emotions, and the task at hand is caring for a loved one that is struggling themselves. So yes, I would second that.
And caregivers together in a group can often be very helpful in building relationships that support their ability to be in the moment and empathic with their loved ones. So it's just a very important concept, and I think it's something that we really should try to build on.
I agree, Dr. Mobley. As a lot of you know, this is something we discuss in our medical training. But when I became a caregiver for my grandmother, it was a lot different. You know, seeing patients in the clinic, but actually providing that caregiving 101, being that person that gives somebody a bath. My grandma used to say, I gave you a bath, why are you doing this? It really gives us a different perspective on that empathy that Dan was talking about. It's not as simple as teaching it, it's really being there. I don't know. But I think it's a good idea to share it in support groups as the role becomes more powerful and actually more manageable. Anyone else? I'm like Carlos looking.
I don't see any other hands up.
There you go.
Right.
I don't see anything else. All right. Well, Carlos?
Thank you to all for your time and thoughtful participation today. Each of you played an important role in advancing this work.
I want to echo that and thank you to our committee members, presenters, and staff for another productive meeting. We look forward to continuing our efforts and welcoming new members in 2026. I'll try not to be in another meeting in the morning. But thank you again, Carlos, so much for leading this morning's meeting.
Thank you. It was my pleasure.
Comments for next year. Do you guys want?
Oh, right. Comments for next year. Now is the time, Barbara. For topics.
Yeah, thank you. Just couldn't unmute myself for a second. So I do think it'd be great if we could get a presentation, maybe even at the next meeting, just to help us understand the mental health services landscape with all the funding changes that have been happening. Because I think in some ways there are more opportunities, but then in other ways, people who've had a certain funding stream don't have that funding. It's a very complicated space. And I think bottom line, we want to make sure that as the dust settles, older adults aren't left with more limited access to mental health services than they started with. So I think just some level setting by having someone come and just present to us what the lay of the land is now would be really helpful.
Any other topics for 2026? I think one of the topics that's left over from 2025 that we did not get to discuss is the topic of fraud. There's adults, especially folks with.
So we can barely hear you. Are you saying fraud? Are you talking about scams? Okay.
One of the topics we were supposed to talk about this year. So I think we can try for 2026.
If it's okay with you all, I can try to reach out to some colleagues who do research in this area. They're not perhaps the most, they don't have firsthand experience, but they have a lot of stories and a lot of research on the topic. So.
I also know I've been in meetings where there have been so the banking industry actually has done quite a bit in this space, and so I've seen presentations from, I have to go back, associations. Like, I don't know if it's called the American Banking Association. I don't remember the exact name. Anyway, there's a couple of interesting programs that they have to try to help prevent elder fraud, financial fraud from happening. So, I mean, I'll share those. I guess with Brian, you're now our point person, right? So I'll share those with Brian, and if that's something that you think you want to have a presentation to discuss the topic, I'm sure they'd be thrilled to present.
Then Anna has her hand raised.
Well, I just wanted to weigh in on that topic because I was curious if this is like a partnership with our elder
EDJCC, Elder and Disability Justice Coordinating Council.
Yeah, so they focus on fraud and abuse. So it just seems like there might be an opportunity to partner with them who has those kind of things on the agenda to think about how we can kind of bring that topic to all of you and them maybe at the same time. So,
great, thank you.
All right. We also have Claire Day with a question.
Yeah, it's just a clarification, not about a topic, but last year we all agreed that we were going to aim for the November meeting to be in person. Are we officially scrapping that now? Is that what's happening? I just want to get some clarification on that because that was my understanding of today's meeting.
I think Carlos clarified that this morning that even though it's recommended, it's not necessarily mandatory. So just also another reminder, it's 3 hours next year. Rather than the 4 hours. Can you hear me, by the way? Want to make sure.
A little better.
Okay.
We should have clarified that before today's meeting.
That's why we included it. Barbara? Oh, earlier you had it.
I did have my hand up, and it was for a topic for the next year, and then we started talking about in person, which I really do think we should still try to gather in person at least once a year. And then I was thinking so much on that, I've completely forgotten what I was going to suggest for, and it was, oh, I got it. A topic. I think that we need to have a meeting dedicated to talking about people who are living alone with cognitive impairment. It is a growing issue. It is a very difficult issue to figure out what to do about it locally. You know what made it pop into my brain was when you mentioned your Elder Justice Coordinating Council, because we're going to be meeting with our public guardian in a couple of weeks, because that's a really important component of the system for supporting people who are living alone. And we're just not sure how well it's working for this population. But the long and short of it is the system is not set up in any way, shape, or form to help people who are living alone. I'll give you one quick example. A gentleman who was an in-home supportive services recipient, and as it turned out, their IHSS worker was never showing up. And by the time someone came to his house and realized no one was ever showing up, he also had a really difficult hoarding problem. So he was in a physically unsafe space. There was no family or friend looking over this to understand what was happening. It was a really tragic situation. He is not the only one. And so I don't think this committee has ever done a deep dive into people living alone. So I would love to see that happen. Thank you.
Oh, my turn now. All right, well, with that, this meeting is adjourned. Have a wonderful rest of your day. You did great.
Thank you.
Thank you.
Thank you, everyone.
The meeting resources will be available on the Cal HHS website. So all these are live links and you can click on them to get all the associated meeting materials. And I believe we have one more slide after that. Here it is. This is our Cal HHS website. And of course, all of our social media platforms. We are there as well. And thanks to the committee and all of our staff and our guests for making time for us today. We appreciate that. And we'll see you in 2026. Take care, everyone.